Good morning, everyone, and welcome to our press briefing, where we are coming to you live from the African Union headquarters in Addis Ababa. This press conference is to discuss everything about the COVID-19 pandemic situation on the African continent. And as usual, the Director of the Africa Centers for Disease Control and Prevention, Dr. John Nkengasong, is here with the details. He will start by giving us a brief, and then we will come to the question and answer session for those of you who are online. It's time now to hand over to Dr. John.
Good morning, colleagues from the media, and it's always a pleasure to have this conversation with you all on Thursday at 11 a.m. First of all, let me appreciate your continuous support and cooperation in the fight against COVID-19. We are living in an extraordinarily difficult and challenging time, dealing with a virus that is spreading very rapidly, very quickly, very aggressively. And I would like to, first of all, acknowledge the remarkable efforts of the healthcare workers and volunteers that are providing frontline services to address this challenging situation. In terms of the epidemiological outlook of this virus, as of 9 a.m. East African time today, the global number of cases has risen to over 4.1 million people in over 200 countries and territories in the world, with over 300,000 deaths, very, very unfortunately so. In Africa, we now have 54 countries that are reporting a total of 72,336 cases, and of that number, 2,475 deaths have occurred, leading to a case fatality rate of 3.4%. The good news is that there have been 25,268 recoveries from those infected. Since the last time we had a briefing on May 7 until the 13th of May, 20,494 new cases, I repeat, new cases, have been reported compared to 14,896 that occurred the week before, that is the week between April 30th and May 6th. This is about 1.4 times more cases reported this week, with an average of about 3,000 new cases reported per day. This week, the West African region accounted for 33%, or 6,839 new cases, followed by the North Africa region, which represented 25%, or 5,200 cases, followed by the Southern African region that reported 23% of the cases, which is equivalent to 4,696 cases. And then the East African region reported 10% of the total cases, which represent about 2,000 cases. And lastly, the Central African region with 9%, representing 1,752 cases. The 5 countries with the highest cumulative number of cases include South Africa, reporting 12,000 cases, Egypt, 10,000 cases, Morocco, 6,500 cases, Algeria, 6,200 cases, and Ghana, 5,400 cases. The 5 countries that I just indicated account for 56% of all cases reported in Africa. Countries reporting the highest number of cases per 100,000 population include Djibouti, Sao Tome and Principe, Cape Verde, Gabon, and Guinea-Bissau. So if you take those numbers and you square them by 100,000 population, that is what we see. Sahrawi Democratic Republic is the only African country, as we speak today, without a case, because Lesotho reported their first case yesterday. So in other words, we now have 54 of the 55 member states reporting at least a case of the COVID-19. We always, as usual, encourage you to go to our website which is Africa's CDC, oneword.org, to update yourself all the time on the situation, the evolving situation of COVID. Let me now transition to what Africa CDC is doing in terms of deployment of responders to support member states. Since the beginning of this pandemic, Africa CDC has deployed over 148 volunteers to support response in different countries. Since the beginning of May, which is just about 2 weeks ago, we have deployed 10 additional volunteers in the Democratic Republic of Congo, 20 in Ethiopia, and 15 in Nigeria. Additionally, 63 are being deployed in Burkina Faso, Cameroon, Ghana, Mali, Niger, Tanzania, Zimbabwe, and Zambia. There are other requests for deployments in Sierra Leone, Sudan, and Chad, and we will continue to support them, this deployment, as part of scaling up the initiative we launched, which we announced with you a few weeks ago, called the Partnership to Accelerate COVID Testing, in abbreviation, PACT. Again, PACT is an important initiative that is underpinned by the ability to track, test, trace, and treat individuals. I think that is the formula and strategy that we are pushing forward across the continent massively. In terms of training and knowledge exchange, in the past week, Africa CDC, as I've heard, held the 9th weekly seminar on clinical community of practice involving 312 active participants to discuss current treatment approaches to COVID-19. We also held a special webinar involving 32 member states with Chinese experts to discuss case management of COVID-19 patients in Wuhan and traditional Chinese medicine as an alternative treatment for COVID-19. We also conducted 2 webinars involving 250 experts from 40 member states on leveraging severe acute respiratory infections and influenza-like illnesses as surveillance framework for COVID pandemic response. The Africa CDC has launched an online rumor tracking system to monitor rumors and misinformation about COVID in Africa. This will track rumors and misinformation across the continent, so that as we continue to move forward, we understand exactly how to fight misinformation and ensure that we provide accurate information as much as possible with your, of course, your close collaboration.